Stigma, silence, and shame seem to be some of the common after effects of COVID-19. The stigma could make returning to normal life difficult, and the silence could potentially further the spread.
The more stigma we put on it, the more difficult it makes it for people.
City News has agreed to keep the identity of this individual anonymous. In early July, the man in his 20s contracted COVID-19. For nearly 2 months, he has been dealing with the aftermath of the virus.
A lack of sense of smell, which I think is just starting to come back now.
But it's not just the physical symptoms that remain.
Primary reason why I wanted to keep this anonymous, Allie, is because I'm looking for a job right now, and I just don't want, Google and, it comes up that he had COVID, and it shouldn't matter. I didn't think it would matter, but it started to, and it comes up by surprise.
Given the all clear from his medical team, he says his life is far from back to normal.
When does that stigma go away? Because if the doctor's unclear, that to me should be the end point, but it's clearly not.
You can be reassured that if the person is recovered, then they aren't transmitting the virus.
Recounting his experience now, he says many are still wary of having contact with him. Alberta's chief medical officer addressing that issue last week, warning Albertans that shame and stigma could have an impact on public health.
It's not the person's fault that they got it. The contact might have been so incidental that it was really just by chance that they were the one that happened to get it. We need to work through the various different stigma and, the disruption that it causes and get past that if we're going to manage this infection to the best of our ability.
If you get sick and you keep it quiet, that does no one any good.
In Calgary, Allie Miller, City News.